What is a phobia? How is it diagnosed? How is it treated? How did one of my patients develop a phobia of soiling herself? What caused this? And how is it related to her compensation? Hello cruel world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. For regular viewers, you know that I usually dissect criminal cases where the perpetrator has or is suspected of having a mental illness. You know my steez. But today I'm going to do something different. I'm going to tell you about a civil court case. So no crime has been committed, but clinical negligence was committed. And I was asked as an expert to give my opinion on the psychiatric issues. So the victim was suing a surgeon after botched operations which ruined her life. I'm going to answer all of the above questions and many, many more in this episode of a Psych for Sore Minds. So sit back, relax, I educate while you levitate. I educate whilst you vegetate. So I'm going to start by telling you about a real life case. So let's call the victim, although because it's a civil case, technically she's called a claimant or a plaintiff, whereas both in civil and criminal cases, it's still called the defendant. So the claimant is called Mrs. Pippin. Obviously, I've changed the name and I've changed some demographic details, as I always do, out of respect of patient confidentiality. But the essence of the case I'm about to tell you is 100% real as the Housewives of Beverly Hills, as real as Ja Rule featuring Jennifer Lopez, as real as the vast majority of my teeth. So when I assessed her, Mrs. Pippin was in her late 30s and she'd given birth in April 2018. And there were complications in the labour, including a serious tear because of the incompetence of the surgeon. So she required a colostomy, which is like a surgical procedure, making an opening called a stoma. And she needed this in her large intestine, in a colon. So it can provide alternative kind of channel for waste to leave the body. And she had to have this in place temporarily for about 3 months. Basically what I'm describing is a big bag of feces, which happens to be how your ex-girlfriend refers to you. So Mrs. Pippin's operation was carried out incorrectly, and the surgeon accidentally made significant cut in the wrong part of her bowel. And then from then on, Mrs. Pippin suffered from urge incontinence and would frequently soil herself. As a very brief bit of background, Mrs. Pippin grew up in Australia with her extended family. She lived in the UK permanently since the age of 20 and she worked as a radio producer. She was happily married and she had 2 other children who were born without any medical complications. Mrs. Pippin never had any contact with psychiatric services before this clinical negligence. She had no history of substance abuse, no significant previous traumas, and no offending history. And I have to say, this is quite typical for the civil cases that I see for court, as opposed to the criminal cases where the perpetrators have a whole host of vicissitudes, such as physical abuse, poverty, drug use, domestic violence. Some of these factors probably contribute to them offending and also contribute to them developing a mental illness. If you're interested in the kind of origins of all that, go and check out my previous video on what causes a criminal. Chickadee, check it out. You Bombay! Why am I outlining Mrs. Pippin's background? It's not just to pad out my videos for longer viewing time, it's actually also relevant in the causation. So if I'm opining that the claimant has a psychiatric disorder, then the judge will want to know, was it caused by the clinical negligence? And if so, to what degree? I will come back onto that about Mrs. Pippin later on. So firstly, what were the physical consequences of Mrs. Pippin's botched operation? So I outlined these in detail in my expert witness report, and I must mention that I lifted the physical consequences from the opinions of another medico-legal report by a physical specialist, because I am not allowed to give an opinion on this because it's outside of my area of expertise as a psychiatrist. So if I did try and give an opinion on this in my formal evidence, the opposing barrister can call me incompetent under cross-examination, and I could be publicly chastised by the judge. And I don't know if you've ever been told off by a man in a wig, but trust me, it is not nice. And worse than that, my evidence might be thrown out of court. Worst of all, I would disappoint my mum. So Mrs. Pippin suffered a range of physical issues, including being in constant pain in multiple areas, all over her abdomen and especially in her perineum. If you don't know what a perineum is, you can always Google it, but I would suggest that you clear your search history straight afterwards. Worst of all, for Mrs. Pippin, she suffered urge incontinence, which basically meant that she would suddenly need to do a poo without any warning, and she frequently would soil herself. So this already sounds like a nightmare. It's already a horrific situation, but it also massively affected Mrs. Pippin's functioning. So the court had to first of all establish a breach of duty, because just because the surgeon made a mistake, that doesn't necessarily mean that it's fair for them to be sued, because people make mistakes all the time. Just ask your parents. So the court has to prove that it was clinical negligence or a breach of duty, two different terms for the same concept. So that means that an expert witness within that speciality of the accused, so in this case a surgeon, they have to make an independent assessment. And this test is kind of judged by the whole medical profession or the peers of that surgeon. So if it is incompetent, if it is clinical negligence, the expert surgeon must be able to show that any medical profession who is in the same position as them would not have done the same thing as what the bad surgeon did. So dear viewers, any budding lawyers or medical expert witnesses out there, do you want to tell me what this test is called? Answers later on in this episode. So another expert surgeon did a breach of duty report in this case. So he decided whether the duty was breached. And it turned out there were other mistakes, not just the botched surgery, but for example, they didn't consent Mrs. Pippin properly before the operation. They didn't get her formal consent. I just did the condition and prognosis part. So basically, I just looked at the psychiatric consequences of the negligence and of the physical issues. I do actually carry out some psychiatric breach of duty assessments once in a while. So the most common type of case I see is negligence that has led to somebody either committing severe self-harm or suicide. For example, if somebody wasn't detained under the Mental Health Act, even though the risks were clearly there, or if they were not provided the right nursing observation in hospital, even though there was a high risk of suicide. If you're interested, go check out my video on the inquest of Adam Stanmore. It's a really tragic case because lots of failings within the system didn't protect this young man, and he eventually went on to commit suicide. Go check my video out if you want to know more about that. I also recently assessed a case of a woman who was psychotic, and because of the poor risk assessment by the psychiatric team, while she was in hospital, she wasn't supervised properly. She went up, broke through a window, jumped off the roof of the hospital, and ended up with 2 broken legs. So if you want me to do a video about that case or a similar case, anonymised of course, then please tell me in the comments section below. I will be careful to anonymise the patient because I quite like to keep my job, thank you. Okay, back to the case of Mrs. Pippin. So her pain was exacerbated when she did low-level activities such as cleaning or hoovering, so it really affected her global kind of functioning. She was in constant fear of soiling herself while she was out in public, which meant that she generally avoided leaving the house. And when she did go on trips, she had to plan her trips meticulously in advance. She would need to know when the toilets were, and she would also eat minimally for a day or 2 to make herself intentionally constipated by taking Imodium tablets. And when Mrs. Pippin eventually did pass stools, it was extremely painful for her because it reopened a number of anal fissures. Come on, Sohom, do not make a joke about that last sentence. Come on. It's okay, I can do it. Just think of how horrendous that situation is, just to leave the house. Plus, Mrs. Pippin had young children, so they constantly demanded activities. And she told me during my assessment that it was just a nightmare, even to do the basics such as going to the park or the playground, etc. And obviously this is all necessary for her children's development and bonding. Although having said that, it is much easier to just kind of shove them in front of an iPad, so I've heard on the grapevine. Mrs. Pippin could no longer do other previous hobbies such as tennis and mountain biking. She was unable to travel, unable to go on holiday. There's basically a massive crash of her social life. And the reason that I'm listing all these things is because they're indirectly contributed to her low mood and her eventual diagnosis, which I'll come to, and it's all part of this type of assessment. Mrs. Pippin explained that she struggled to be intimate with her husband due to physical problems because of her incontinence on top of everything. I think we'd all agree that that's a bit of a vibe killer. Unfortunately, Mrs. Pippin, on top of everything I've mentioned, on top of all these issues, she had to give up her job. She constantly had to leave the radio station studio that she was working in to go to the toilet, and possibly they thought she was a cokehead or something, which means she couldn't afford the mortgage on her home. And basically what I'm trying to say is this whole situation had a huge impact on many aspects of her life. So, what were the conclusions of my medico-legal assessment? What were the symptoms that I elicited from Mrs. Pippin? What is the diagnosis of mental illness that I concluded? How did this affect her overall compensation? I would love to answer those questions, but first let me introduce you to this channel. You're watching Psych For Sore Minds. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. Even though this is a civil case, generally I assess mentally disordered offenders in courts, in prisons, in secure psychiatric units. I act as an expert witness in criminal courts. This channel addresses a whole host, a smorgasbord, if you will, of issues related to mental illnesses and to offending, and the crossover between the two, betwixt the two, I would like to say. So I analyse high-profile true crime cases. I talk about my own cases like this one, anonymising them. I interview patients with some sort of experience of criminality or of mental illness. What I'm trying to say is there's something for everybody on this channel. I am your favourite Asian British forensic psychiatrist with a gold tooth in London, or at least in your top 5. I implore you to subscribe to this channel. Not only does it help me out immensely, but it also guarantees that whenever you go poo-poo in public, there will always be toilet paper in the toilet. Guaranteed all your money back. Okay, so what is the test of clinical negligence that I mentioned before? Drum roll please. The test is called, that's right, the Boland test. If you got that right, go buy yourself a cookie and you can Bill B. You Bombay. Okay, so what were the symptoms that I elicited from Mrs. Pippin? She had low mood on a daily basis, decreased motivation and energy levels, a lack of pleasure, a sense of hopelessness. She had poor sleep. She was frequently ruminating about a situation. She had these very specific fears related to soiling herself, and she was preoccupied about this. This would make her irritable and snappy. She suffered feelings of guilt from not being able to emotionally connect and bond with her baby. She even, I'm afraid to say, had occasional thoughts of suicide, although she didn't have any direct plans, thankfully, to act on them. And I have to say that in this particular case, there was confirmation of most of these symptoms within the general practice notes, and Mrs. Pippin also briefly saw a psychiatrist who prescribed her antidepressants, so I had objective evidence. The reason I'm mentioning all of this is because it makes my assessment a lot clearer, because there's more evidence to strengthen what she's reporting to me. Occasionally, I have to do assessments where, for whatever reason, the claimant doesn't present to medical services with their psychiatric issues, which basically means that I have to just report, I have to rely on their reporting. So it's still possible for me to carry out the assessment, but as you can probably imagine, it leads to much weaker evidence. So what were my diagnoses? Well, first, I thought she suffered from a depressive episode or depression. So everybody knows that depression is about low mood, but it's also associated with poor levels of energy and motivation, and also anhedonia. So anhedonia is a lack of pleasure in previous activities. We psychiatrists like to use fancy terms to sound cleverer than we actually are. I particularly like to use long words like anhedonia and vicissitudes, which I mentioned before. And I do that just to prove that my vocabulary is good. And compared to yours, it's much gooder. So depression also has somatic symptoms, such as reduced appetite, self-esteem, confidence, reduced confidence, poor concentration, poor attention, problems with sleep. So basically, Mrs. Pippin, as I said before, had many of these features therefore strengthening my suspected diagnosis of depression. You Bombay. But the focus of this episode is the other diagnosis. You know what it is. It's literally in the title of this episode. It's phobia, or in psych jargon, specific phobia. Next question. What criteria are necessary for the diagnosis of phobia? Well, it's highly specific. It's a fear to a situation or an object. So typically it's things like proximity to particular animals, or for heights, or for thunder, or for the sight of blood, or for black people. Oh no, sorry, wait, that's racism. My bad. I'm allowed to make jokes like that because, because I'm racist. No, only kidding. But I do have a lot of friends that are racist. So for a full diagnosis of phobia, you need to have the following. There needs to be a psychological or a physical reaction to triggers of the anxiety. Physical reactions would be things like increased heart rate, blood pressure. So, dear viewers, do you want to know the only thing that scares me? For me, the only fear is fear itself. And clowns as well, clowns, yeah. Dear viewers, do you have any phobias? Please tell me specifically what your phobia is and your avoidance behaviour. I'd love to get a bit of chat going in the comments. I'd love to know your experience. Please share it in the schmommen below. It must be restricted, the phobia must be restricted to the presence of that particular object and situation, so not in general, and triggers are avoided where possible. So I think in Mrs. Pippin's case, in my opinion, her becoming reclusive and reluctant to go out, apart from when she meticulously plans the toilet routes, was a form of avoidance. So far, so good, but the court doesn't just want a diagnosis, they want an opinion on causation. So they want to know, was the depression and the phobia caused by Mrs. Pippin's clinical negligence and the botched operation? Luckily, this was quite a simple case, as Mrs. Pippin had none of the risk factors that I mentioned before about developing depression, such as family history, attachment issues, traumatic childhood, or any sort of predisposing medical condition, for example, being treated in the past for depression. She didn't have any drug and alcohol issues, she had no psychiatric history. So that means the depression was really easy to diagnose, or the causation of the depression was easy to establish. Phobia, also easy to figure out because it only existed when she was in that specific situation, i.e. soiling herself, wasn't there before, had the operation, is there now. Simples. Some of the other assessments I do are a bit more complicated. Depression, for example, as you know, can be multifactorial, therefore there can be lots of different complexities, but in this case it was easy to establish causation. Okay, so my recommendation was that Mrs. Pippin had psychotherapy. So as well as cognitive behavioural therapy, I also recommended graded exposure therapy. So listen up, all you budding psychologists out here, I'm trying to teach you something here. This is a very specific treatment for phobias, and I describe it kind of like this. So exposure therapy is where you focus on changing your response to the object or the situation that you fear. And it's gradual, it's repeated exposure to that phobia and the related thoughts, feelings, sensations. So you get used to all of these things whilst you're simultaneously working on relaxation techniques. For example, let's say you're afraid of elephants. Then your therapy might start from simply thinking about elephants, petting an elephant, to looking at pictures of an elephant, to going near a real life elephant, to touching its legs, to touching its tusk, to licking its trunk, and then eventually fighting it to the death. So I suggested in my report that Mrs. Pippin had 15 to 20 sessions, and I explained that they cost around £130 to £150 in the UK, and the judge accepted my evidence, and this was incorporated into Mrs. Pippin's overall compensation. There would have been other elements of compensation, such as the money she lost from work, cost for medical appointments, cost for the pain she suffered, etc. But none of that's my area of expertise, so I'm not allowed to give comment on that. Obviously, her physical problems would remain, and therefore I didn't expect her phobia or her depression to be sort of magically cured with this therapy, but it was more about finding strategies to handle it, to contain it, and to support her. I also suggested that if the therapy didn't work, Mrs. Pippin could consider antidepressants in the future, although personally I didn't really push this too hard in the report because it's not really a solution to a problem where the cause very obviously is physical damage. So despite what you might think, with all you anti-psychiatry trolls out there hunched over your keyboard, I'm a psychiatrist, and whereas I believe some medication can definitely help in some circumstances, I know that for a fact because I've seen it many times with my own eyes, it's not something that I would prescribe flippantly. Okay, let's wrap things up. I'm a busy man and I'm very important. In conclusion, what have we learned? We learned how Mrs. Pippin developed incontinence and eventually a phobia. We learned how a phobia is diagnosed and treated. We learned how we all make mistakes. I mean, not me, obviously, but everybody else, mere mortals like you. And we learned about the clinical negligence test known as the Bolam test. And we learned how compensation in part is tied into psychiatric illnesses in these prognosis and condition reports. Is there anything else I need to... Sorry, what's that? Of course. How could I forget? My book, buy it. It's going to be called In Two Minds, March 2022. It's dope. It's a bit like this channel, but more detailed, more autobiographical, a lot more of my criminal cases, lots of gory, fascinating, heartbreaking stories in there. You need to buy it. Please spread the love and tell everybody about this channel, because I'm a very vain man and I'm very insecure and I need love, I need subs. So help me out, please, tell people. And also, your friends deserve it. And finally, all I have to say is stay euthymic. Please do not forget whatever happens. I love you.